Coulmas and Associates does health psychology counseling services in the Atlanta region. When a person has a stroke or a person has a terminal disease process, the whole family's affected. So we try to focus more on the package therapy than the individual therapy. Whoever is taking care of this patient needs to be of a healthy mindset to survive for themselves and to provide a good background for the patient to help recover. You hit medical tourism on Google and you're going to be hit with, I don't even know how many pages of references, because they do 10 at a time and it just goes on and on. That's not a way to shop. If we could have a source for acceptable standards for a client to ask or a patient's family to ask a provider, what are you going to do, how are you going to do it, in other words, offer a good reference for them to be able to shop well and be an unbiased source of, if you go to a particular hospital, they're going to tell you they're the best. What I think the Medical Tourism Association could provide is a unbiased reference for an innumerable number of internet researchers who are trying to just find out what it is they're supposed to know before they go buy this. You can find out how to buy a good car. You can find out everything you need to know about the tires on your car. But when it comes to medical tourism, how do I find out what I should know before I even go any further? I think if people can become educated and become less intimidated by the fact that these processes are so far away, anyone could get on a plane and go to the Cleveland Clinic for a heart valve replacement, top notch. Why not get on a plane and go to some place that you could, the average person that I was talking about, certainly wouldn't be able to afford that process. But they could have, with a little bit longer travel time, they could afford a very good heart valve replacement. They just need to become accustomed to the idea that foreign medicine is equal to what they can get here. And it's in their benefit to start researching into that information. With the condition of the medical industry these days, I was just interested in somebody actually providing a viable alternative to middle income lack of ability for fairly financially substantial medical procedures. These are the group of people, the groups that I think would benefit most from this. I'm sure everybody could benefit, but there are people caught in the middle who don't have enough insurance. They have some insurance, but a heart valve replacement is a lot more palatable at $35,000 than it is at $250,000. One, you lose your family and your life. The other one, you just have a big payment, car payment. It's a much better way of treating than having the government step in and mandate. From that perspective, I think offering alternatives that are affordable is a very client-centered way of approaching this.